White rice, a staple food in many cultures, poses a substantial risk for individuals living with diabetes when consumed in excess. Unlike whole grains, white rice is highly refined, with the bran and germ removed during processing. This stripping significantly reduces its fiber, vitamins, and minerals, leaving primarily starch that is rapidly digested into glucose. As a result, consuming white rice can cause sharp postprandial blood sugar spikes. For someone with diabetes, whose insulin production is limited or whose cells are insulin resistant, these rapid glucose surges place intense stress on the pancreas, requiring large amounts of insulin to manage blood sugar levels. Over time, repeated cycles of high blood glucose and compensatory insulin secretion accelerate beta cell dysfunction and worsen insulin resistance, complicating long-term glycemic control. The metabolic impact of white rice is amplified when consumed in large portions or alongside other refined carbohydrates, a common dietary pattern in many meals. The combination produces a compounded glycemic load that destabilizes blood sugar for hours, often making it difficult for individuals with diabetes to maintain stable glucose levels even with medication or careful monitoring. Habitual consumption of large servings of white rice is associated with increased visceral fat accumulation, promoting systemic inflammation, insulin resistance, and metabolic syndrome, all of which are critical factors in the progression of diabetes and related complications. White rice also contributes to dyslipidemia when consumed excessively. High glycemic meals can elevate triglycerides, reduce HDL cholesterol, and promote the formation of small, dense LDL particles, all of which accelerate atherosclerosis and increase cardiovascular risk. For individuals with diabetes who are already predisposed to heart disease, the repeated metabolic stress caused by excess white rice significantly heightens the likelihood of heart attack, stroke, and peripheral vascular complications. Behaviorally, white rice is often consumed multiple times per day due to cultural dietary patterns, making it easy for individuals to ingest excessive amounts without realizing the cumulative glycemic burden. This frequent exposure reinforces patterns of hyperglycemia and repeated insulin surges, contributing to progressive deterioration of pancreatic function and exacerbating weight gain. Even when balanced with protein or vegetables, excessive servings of white rice can destabilize glycemic control and undermine careful dietary management. Research consistently shows that high intake of refined rice is linked to increased risk of type 2 diabetes development, poor glycemic control, and higher incidence of cardiovascular complications. Substituting whole grains such as brown rice, barley, or quinoa can significantly moderate postprandial glucose response, reduce insulin demand, and improve long-term metabolic outcomes. For individuals with diabetes, white rice in excess is far more than a simple carbohydrate. It is a potent and cumulative threat to blood sugar stability, insulin sensitivity, weight control, and long-term vascular, renal, and neural health. Avoiding large quantities and replacing them with higher fiber alternatives is critical to slowing disease progression and reducing the risk of severe complications. The danger is cumulative, insidious, and often underestimated, making white rice a deceptively high-risk staple in the diabetic diet.